Well, the ICC project came about first as a result of listening to what patients and families told us they wanted and what they weren't getting so well in the current healthcare system. And what they told us over and over and over again was the points of transition are very confusing for us. When I'm moving from my family doctor to my specialty physician, in the case of surgery, to my surgeon, then to home care, and then as I get handed back to my family doctor, often he or she didn't have the information of what had happened to me in the ensuing weeks or months. And oftentimes we actually get mixed information or sometimes directly opposing information, and we're not sure who to listen to. So again, our focus really was to say, clearly we can coordinate care better, and clearly we can make the patient experience a better one. So we stepped back at their request and suggestion and started saying, if we were unencumbered by the current structures and models of care and funding methodologies, how would we design this? And we redesigned that care process, again, always asking the question, who's the best care provider that we can offer at this point, and who's the most inexpensive care provider so that we can leverage more money to serve more patients?
So St. Joe's as a healthcare system has both acute care hospitals and essential home and community support services under the same governance and management structure. So what that will do in a project like this is it aligns the service delivery model. Currently, the way the systems are done now is that you would be discharged from the hospital and then you would be enrolled into home care services. In the model we're piloting right now, that's seamless. So there is no discharge function. It actually is the full spectrum of care while you're under the St. Joe's umbrella.
What we've historically provided for patients is where the patient would get what they experienced as sort of segments of care. And in this project, one of the things we were trying to fix is patients have an experience that the care can be fragmented, so that pieces of it aren't well connected. And the purpose of this project was to create a much more integrated approach in which the patient has the experience of continuity of care and continuity of information. This model provides a difference in that we have one person who's assigned to that patient to coordinate the team and the care, and that person takes a key role in understanding the patient's particular and individual needs and ensuring that as they move, whether it was through surgery or through a medicine admission and back home, that they really do have their needs met in a very purposeful way. For staff, having information in a timely way helps them do their job much more successfully. And in this project, that's the way in which we've been able to really provide continuity of information as the patient has moved from one part of the system to the other. The staff tell us has really increased their efficiency and increased their satisfaction.
I phoned my doctor and he took me right away. I was amazed.
You got in to see your family doctor?
Yeah.
Good.
Very
I'm glad
nice.
that he's on board.
Yeah.
The Integrated Comprehensive Care Project has offered tremendous benefits to our patients. Number one being the ability for the healthcare providers to communicate with each other a lot easier, therefore supporting our patients in the community more thoroughly. We have a number of healthcare providers involved in this project: physiotherapists, occupational therapists, dietitians, social workers, PSWs. Depending on the need of the patient, we bring those healthcare professionals into the home. Our patient Eileen, for instance, she has seen a number of these people in her home. This provides our patients with the benefit of being able to maintain their health in their home, so they're hospitalized less.
The Integrated Care Coordinator role is new and it is unique to St. Joseph's Health System. It breaks down barriers that exist in our current healthcare system. It enables patients to access care in a timely manner, the right care at the right time.
If it wasn't for this program, I wouldn't be here. So that's what I say. Anything you can do to encourage this program will save so many lives. I am grateful for the last 8 months. And it saves so much money on the taxpayers. And the freedom you have, because if you get a day when you don't feel good, you just call your nurse. And they're there the very next day. The nurse is on call 24 hours a day, 20 minutes, you got a phone call. It's just amazing what they do for you. So you don't have the depression with your disease anymore that you did before. Like now I don't worry, because I know if I do get a little spell, All I gotta do is call Danielle.
On any given day, I might be arranging Skype calls with patients and doctors and nurses. I might be triaging patient calls to determine needs, and I might be consulting with the nurses in the field to determine the best care possible for the patient.
So the staff are really feeling that they're caring for the patients in a different way than they would have before. They really feel like they're able to support the patients through their entire journey, which includes the hospital experience and the home care experience. They're able to communicate with the team members, relay information that's important as part of their care. They're able to access care quickly for the patients when they need it. And that's a very different process than happens currently in the system. They really get the positive feedback from the patients as well that this is working for them, and they really feel like they're able to work to their full capacity in caring for patients.
For me personally, it's been very rewarding. I'm able to do more teaching and more in-depth teaching with my patients with regards to their disease process and teaching them ways in which they can manage a lot easier in their home. Overall, it's allowed the nurses to be more involved in the home, and not just the nurses, the entire team. And it allows our patients to be able to feel comfortable in their homes and safe, and knowing that there's the support when they need it.
So the most important thing that we hear back from the patients who have been through the program is really how they feel supported through the whole process. So their care usually involves many stages in hospital and at home, and they really feel like the team is able to follow them through the entire journey and really being able to support them. They feel like they're not leaving the team when they leave the hospital doors, that team is really following them in the community and able to answer their questions and support them if something does need to be looked after when they're home.
The integrated care coordinator role provides patients with one point of contact for them to access any care that they feel they should need. And it provides patients in the community with the reassurance that they haven't been forgotten.
Good. Clear as a bell.
Oh, what a relief.
I know.
I always feel good when you tell me that. The last time I was in the hospital, when I come out of the hospital, I weighed 102 pounds. Since then, I've gained 16 pounds. And I've done amazing. Like, my family can't believe that they didn't expect me to live, to be honest. I was that bad. I believe this program actually saved my life.
I think we can provide care to patients in a way which is much more patient-centered, where patients feel the team is caring for them, meeting their needs in the way that they believe their needs need to be met, and that experience which sometimes is a very difficult experience, is the best that it can be, given the health insult that they've had to deal with.
So I think the ICC is incredibly important to the Canadian healthcare system because it's going to demonstrate, or not, a number of issues. One, can we find a better integrated, similar or lower cost alternative than the way we deliver service? Number two, can we improve quality of work life for beleaguered staff who are also feeling very pressured with long lines of patients, no real end in sight, and at times feeling as though the future isn't looking bright for me as an employee or a provider? And third, and certainly not last, is how do we, in an economically challenging time, ensure that we can preserve the very best of healthcare delivery and the access for that healthcare delivery to all Canadians?
In the traditional model, we worked in silos. Now, as a team, we're trying to wrap the care around the patient, keeping the patient center as the focus.
I can't encourage anybody more than to support this program. Today I feel really grateful. Like I said, the change in the last 8 months is unbelievable, and really happy with the way my progress is coming along.